Thank you for listening to Pierce Clinic Stories, the program where we hear testimonial stories of the patients of the Pierce Clinic of Chiropractic in St. Petersburg, Florida. The Pierce Clinic doctors are experts in... Oh, dang it, I can't say experts.
Dude, I haven't eaten dinner yet. Can you speed this along a little bit, please?
All right. Thank you for listening to Pierce Clinic Stories, the program where we hear testimonial stories of the patients of the Pierce Clinic of Chiropractic in St. Petersburg, Florida. The Pierce Clinic doctors focus on the upper cervical area of the spine, and they help people with various conditions. Today I'm with Dr. Fowler, one of the doctors at the Pierce Clinic. Hello, Dr. Fowler.
Hello, Dr. Hambrick.
And today, Dr. Fowler is going to tell us about a patient who was dealing with infertility and how they were helped through the evaluation that they received at the Pierce Clinic. So tell us about this lady.
Well, interestingly that you say that, Dr. Hambrick, is that oftentimes infertility issues do seem to be geared towards, or the focus seems to be drawn more towards the female when we consider these families' inabilities to get started. And this particular case has to do with a young man who was the challenge of the couple regarding this couple and their family initiation. The young lady of the relationship had actually been a patient of the office for quite some time. She had come in when she was very young. Her parents were educated well in that so much of the development that needs to go on for their children needed to be supported solely by their nervous system, and wanted to make sure that the other elements of spinal support were in place so she'd have the best opportunity towards success as she grew into an adolescent and a young adult. Her husband, on the other hand, was involved with many things. One of them included high school wrestling. And he competed at a state level in many situations where he would find himself in precarious positions of headlocks and different types of pinning, whatnot, in order to avoid and also to gain points for his wrestling points and systems of his competition. Well, amongst many of those different irritations that he'd had, also amongst some car accidents that he'd also experienced, it had gotten to the point where his posture was so far off, I wonder if you can see on the video, that his ear and shoulder were virtually touching when he would look into the mirror. That's the type of postural distortion that he had had, and some of his friends had pointed it out, but never really knew how to tell him how to get some help with that. Well, he was visiting with some friends at a wedding that we were also invited to, some friends of the office, and we were able to talk with him a little bit about this postural stress that he'd had and that it might be related to his nervous system and some potential dysfunction. So through a little bit of coercing and education, we were able to share with him the opportunity to come in for an evaluation to see if there was something that we could do to help him. Now, at this time, he and his wife had been working on building a family and were just recently successful in having their first baby boy. It had taken them, I believe, if I remember correctly, over 3.5 years for the couple to get pregnant. They'd been trying and were very discouraged and had explored some other different types of fertility options that were available for them with in vitro fertilization and other types of artificial insemination, and determined that they were going to just stick with it, and if they were to be blessed with children, that it would happen with his natural way. So after coming here to the office and sharing a little bit about his history, not only did he have the shoulder stress, but he had some elements of headache. He'd also had some elements of wrist pain and lower back discomfort. We were able to perform an evaluation on him that also concluded his primary insult was derived from some sort of a wrestling move that he had incurred back in his high school years that had subluxated his atlas vertebra. Now, the word subluxation is, again, a fancy term that just means a hard bone on a soft nerve, and we located his at the very top part of his neck. Specifically, the atlas vertebra is the name that we give to that very top bone. And upon determining that, not only did we find that his issue was chiropractic in nature, but that it was also something that we could help with, we immediately set him up an appointment for x-ray to be made of his neck so that we could visualize the bones the easiest way, using a state-of-the-art three-dimensional x-ray system to figure out exactly what needed to be done with his system to get his nerves back online and get his body functioning better to help him with his factors. Now, as you notice when we talked about his history, we hadn't really talked about this main issue of infertility because he hadn't really mentioned it to us before. Again, the speculation was that the challenge was with the female, not with the male of the partnership. And after we made his x-ray and we studied what was happening with his skeleton structure, we found that his top bone had moved to his right. His neck had compensated off to the opposite side, to his left. The second bone in line was turning in an awkward position, rotating to the left over 6 degrees, where his top bone was rotated in an opposite fashion. So he had what we call a variable or a counting rotation. Now, those two together are very intriguing when we look at not only nerve function but also vascular supply for him, because they're rotating against each other almost as if it is a wringing of the dishcloth type of an effect, or wring the water out of that material. When we were able to utilize our state-of-the-art percussion adjusting instrument to uncoil this misalignment factor in his upper neck, that's when we started to notice some amazing changes. Because it was almost immediate that we saw the muscles were untwisting in his neck and shoulders and even in his lower back. Now, the key factor for us in that lower back element is that most of us will know that when we study different types of anatomy, we see that those nerves that come out of the lower end of the spine through L3, L4, L5, even down into the sacral elements there, those are the ones that support the reproductive area. He did note some degree of low back discomfort before, but that wasn't even one of his primary stress factors. And over the next couple of weeks, we were able to see his body begin to recover, also to be able to see how his body was changing, making some improvements. Interestingly enough, he started to feel a little bit worse before he got better. He's a very big boy and, in essence, an amateur power lifter at the time, and was noticing some stress and some recovery necessary as he worked out at the gym. But they decided that it was time for them to try having another member of their family join. And this time, not 3.5 years later, it took them but 2 weeks in order to get pregnant once they had tried and determined that another family member was on the way. Mm-hmm. So how rewarding for us to be able to assist them with their ability for function and to be able to get things online. You know, the wonderful thing about the nervous system and the human body especially is that it doesn't really need a lot of help. Just no interference. And that's what we're striving to do, is to get the body online so that it can perform its normal functions on its own and be able to have that quality of life, whether it would be absence of pain, infirmity of disease, or even optimum function.
Well, you got me. I
Yes,
thought
indeed.
for sure it would be about a lady, but
Oh, yeah.
well, thank you very much, Dr. Fowler.
You are
We'll
welcome,
talk to
sir.
you
My
later.
pleasure. So long.